basically a procedure to elevate the breast mound and the nipple. Generally, with aging or pregnancy, the breast can drop and fall, and the idea, of course, in this procedure is to restore the perkiness of youth. A lot of women who want a breast augmentation because of deflation with age or pregnancy actually would need a lift first, meaning that we have to put the implant behind the nipple, and if the nipple is in the wrong location, that is below the fold, then you'll have what's called a double bubble, where you have an implant and then a breast. So we have to elevate the breast mound or nipple to reposition it in the area where the implant's going to go. For a breast lift, there are different ways we can elevate the mound of the breast and the nipple. Sometimes we really just need to elevate the nipple a little bit, and that can be done through just a simple skin excision and moving the nipple up. In more extreme cases where there's actually descent of the breast mound, we have to remove skin to elevate the nipple and breast mound. And depending on the amount of droopiness really determines how many incisions we need to do this. And as a rule, the more descent, the more incisions. The three major incisions are, one is around the areola, where we can actually excise skin circumferentially around the areola and bring it in. A lollipop or vertical mastopexy, and that's when the incision is around the areola and vertically down the breast. This is done with moderate breast ptosis or droopiness. If there is significant ptosis and that can't be corrected with the lollipop, then a horizontal incision is made as well. And that's called an inverted T or anchor incision. And that's generally done for patients where the nipple position and the breast mound is significantly below the fold. And the fold and nipple position is really an important relationship we have to look at when we're talking about who needs a lift and who just needs their breast augmentation. Because some women who have a deflated breast that has a little bit of sagginess in the bottom pole of the breast can benefit simply from reinflation of that volume with an implant without doing all these incisions we talked about. The downside to a breast lift, at least through the approaches that leave the incisions that are visible in the vertical and horizontal components, is that there are scars. And we're trading a better shape at the expense of scars. Most patients who want a breast lift and have significant droopiness that makes them feel uncomfortable or not attractive will gladly trade the scars for the shape, and almost always find the results very pleasing and improves their self-esteem because of course they feel more comfortable with their breast shape.